implementation. And I'll just highlight that in chatting with them ahead of time, I'll let them introduce themselves, but in chatting with them ahead of time, they were excited about getting questions from this group kind of as we go along. So I would just encourage you to, hop off, put your video on and hop off mute to ask a question whenever it strikes your fancy. And I'll hand it over to you two.
Great, thanks, Katie.
Thank you, Katie. So I'll just get a slide set up for us. There we go.
Well, thank you for joining us today. I think we're going to do quick introductions and then get started. So I'm Heather Gotham. I'm a clinical professor, a clinical psychologist by training, and work in Stanford Center for Dissemination and Implementation. All of my work has implementation science at the base of it, and much of my work has to do with helping different kinds of health professionals implement effective practices and programs. So glad to be here today.
And I'm Hélène Chopron-Garneau. I'm a senior research scholar at Stanford University in the School of Medicine. My background is in public health, and I come to this work very much interested and eager to be able to translate or help organization adopt or adapt, if needed, evidence-based practices, and really filling that gap in the translation between research and care delivery. Are you ready to get started, Parker?
Mm-hmm. Let's go.
Okay. We for dissemination and implementation, which really kind of operate and for vision that everyone deserves access to the best healthcare. And so at Stanford CDI, we're the umbrella center or the home center for 3 nationally funded centers that all work to that end. There's the Center for Dissemination and Implementation at Stanford, the HEAL Data to Innovation RASC, so the Research Adoption Support Center, and the Center for Mental Health Support, Center for Mental Health Implementation Support. And just for given the timing, I don't think we need to go very deep into what each of these centers does or their nuances, but it's something we're happy to provide more information about towards the end if time permits.
Just putting the link in the chat to our overall CDI webpage where you can get to all the projects that Hélène just mentioned. What we're focused on today, though, is we really feel like as implementation scientists, we have something to give and to bring to all of you who are focused on improvement science. So I wanted to just reflect for a minute on the importance of integrating implementation science and improvement science. I think both sciences have a lot to give to each other. So was thinking about and looking through these great manuscripts or articles that talk about challenges to integration. So people talk about, I don't know if everyone would agree with these, but people talk about implementation science being the how to do the right things. So implementing evidence-based practices as opposed to practices that aren't as evidence-based or aren't based on community-defined evidence. And improvement science is how to do things right. Make sure that the practices are done thoroughly, efficiently, and reliably. And again, I'm not necessarily a purist. I think there's overlap between the two sciences. But I definitely think there are benefits to integrating, like strengthening the research practice partnerships by supporting healthcare systems improvement projects, which is why we're here as folks who are engaged in improvement projects in the Med Center and in your own work. We are here today to talk about some guides and measures that we've developed through implementation science that we think might be beneficial to your work. So we want to share those with you. Employing implementation science tools to foster generalizability. So one reason we bring these tools to you today is that it can for QI projects that are really focused on one clinic or one set of clinics or one something, sometimes bringing psychometrically sound tools, and we have some of those, can help bolster the generalizability and maybe the fundability or the publishability of the work that you're doing. Not that there aren't psychometrically sound improvement science tools, but we're bringing some more to put in your tool bag. And then building the overall capacity of the healthcare system and of Stanford to implement evidence-based interventions and improve care. So that's why we're here. And again, hoping that what we have to bring today is going to be really helpful and relevant.
And so one of the things that implementation science has struggled with over its existence, which is only about 15 or 20 years or so, is that it's yielded a plethora of frameworks, strategies, and measures. It's become a little bit unwieldy in trying to identify which one to use to tackle a challenge or a problem. And we tried to our intent was to simplify it. Because instead of the 1,000 Lego set, what we really need when we talk about implementation science or implementation practice are really kind of the Duplo set, the simple building blocks that are going to help us do the work that we need to do. So our national centers got together and worked towards developing and disseminating these pragmatic, practical guides and measures to help democratize implementation science.
So what we're going to present today is this group of implementation guides and measures that are really focused on 5 key domains within implementation science. Again, trying to go to the Duplo set, so let's only focus on 5 key domains. So this is the list. We'll go briefly over each of these, but are really hoping that we're providing a taste for some things that might be helpful and beneficial to your work. So we have overall, we have the DIRC SS, Dissemination Implementation Research Capability, self-survey, and then we have specific guides and measures related to 4 of the 5 domains that are here. And we'll talk about what each of the domains means and again, give you a taste of what the tools are for each. So I'm going to go to the next slide. So
I think Heather might be frozen. I can jump in. So the DIRC SS is a pragmatic measure of implementability when you think about your research, right? Or the evidence base or the intervention you're developing or testing. The idea is to try to document the extent to which a project is using implementation research methods. And so it has, again, 5 key dimensions. We really, like Heather said, tried to stick on the Duplo and make it simple, right? So we focus, the DIRC SS will evaluate a project, or kind of, it's not an evaluation per se, but it's kind of generate feedback around, the evidence you have for your intervention, how you're engaging with partners, what are the contextual determinants that may affect the implementation, how are you going about implementing the intervention or the practice, and what are you considering, right, in terms of implementation and sustainment outcome. It can be used at the start of a project and it could be used to as a guide to design your project, your implementation project, or your improvement project, and it can be used throughout to kind of monitor the progression.
And then I'm back if you want me to jump back in. Sorry about that.
Sure.
Zoom fun today.
Feel free. I think I was ready to move on to the next slide, so you can pick it up there. Yeah.
Great, thank you. So the DIRC-SS is a team-based self-assessment. So we're really hoping like gather together with your research team, go through the items, and come to consensus, based on where you think the project is at. We tried to build it so there's no implementation science expertise necessary. 5 dimensions, as Ellen introduced you to. There's 3 items per dimension, so it's only 15 items, and they're ranked on a 5-point scale. We really hope people, try to be honest, and the point here isn't that everyone's above average, but it's really to get kind of a sense of where you are in terms of using these implementation research methods in your project. And the really cool thing about it is based on your own responses, you can see where you are on each of these domains, and consider if there's something different to do that you want to do with your project in order to increase your capability or to use some implementation research methods. And in terms of budget impact, sometimes it's 0. Sometimes adding a measure will not have any impact. Sometimes there would be significant budget impact, but that's not always the case. So on the next slide, Ellen had mentioned that one of our 3 big projects here at CDI is providing support to 10 HEAL-funded projects that are looking at implementing evidence-based practices for opioid use disorder and pain management. And we use the DIRC-SS with those 10 research projects, where we had the project rate themselves, and then our RASC expert implementation science experts rated them. And this is just a snapshot at baseline at the beginning of the projects of kind of where people were, where the projects were. And you can see that there's some variation. Some people were doing really great in terms of engaging partners in the research process. Places where there was maybe not as high scores had to do with contextual determinants. So that would be a place where we could recommend, maybe it would be helpful to add a measure in your project to look at the barriers and facilitators of implementation or the contextual determinants in order to help you understand what, if there are implementation strategies or things that you can do to help overcome the barriers to implementing the practice. So we found that this was really helpful. You can go to the next slide. A really helpful process to do with these research projects. This is systematic information, so there's, it's based on a checklist, not just like an implementation science specialist coming in and rating your project, but it's systematic. And the DIRC-SS, the responses really helped us have conversations with the research teams about opportunities to enhance the use of implementation research methods. Again, adding measures, or just, maybe engaging more partners or doing things like that, which led to some great dialogue between the research teams, and in this case, the implementation research experts. But again, there isn't any implementation science expertise needed to do the DIRC-SS. So that's kind of a global one. And now we're going to talk about some guides and measures for each of those core domains. And I'll, yes.
Do you want questions throughout, or do you want to?
We can take questions.
Could we go back to the chart or the table? Yeah, this one. Am I right that it's like the 1, 2, and 3 are the 3 different time points?
The 3 items. So this is an item by these are the 15 items. This is just baseline.
Got it. Okay.
Yep.
Then I don't have a question. So the question was just a clarification about the chart. Awesome. Thank you so much.
Sure. I'm going to go ahead and talk about the partner engagement guide, which is one of the guides and other guides and measures. This is a quote about the importance of partner engagement. I don't know, I'm sure we all understand that very well, but in terms of implementation science, you got to have partners engaged in order to build an intervention that anyone is going to want to use, and the anyone being that patients are going to want to engage with, or that staff are going to want to implement and adopt and use. So we, although partner engagement isn't necessarily always like something one thinks of when we think of implementation science. We think it is essential. So next slide, we gathered together a national work group and developed the implementation or the partner engagement guide. It includes information like the 7-step partnering process, where we go through each of the steps and talk about how a research project can move through these 7 steps to partner with the folks who you need to have engaged in your project, all the way through evaluating the engagement and then disseminating information about the engagement strategy and outcomes. Next slide. The partner engagement guide also includes some supplemental resources, including training for partnership engagement, some really great worksheets. There's a strategic planning worksheet and a support and resource checklist to make sure that you have the support and resources you need to do partner engagement really well. And then there's a couple great case studies of research projects, kind of a before and after, for how they've been able to engage partners and how that's made a difference in their work. So partner engagement guide. And with all of these things, this isn't like a 50, 70 page guide. It's trimmed down to something that's really, we hope, accessible and usable. And I think we're going to turn things over to Ellen to talk about the next one.
Yes, so I will provide an overview of the contextual determinants tools that we've developed. We have one that is qualitative and one that is a little bit more quantitative, but can also actually be used to really facilitate conversations around bears and facilitators. So contextual determinants matter, right? Context shapes how an intervention or a practice is implemented, delivered, and sustained. And context will also matter because it can guide the selection of the implementation strategies to increase reach, adoption, maintenance, and sustainability. And when we talk about contextual determinants, we use the terms interchangeably with barriers and facilitators, right? So barriers are things that would get in the way of implementing, and facilitators are things that we can leverage and build upon to implement an intervention. And they're multi-leveled and dynamic, right? And at times there's a little bit of a domino effect that if you affect one barrier, one facilitator, something else changes in response. So we really wanted to develop a pragmatic and user-friendly guide to help identify these barriers and facilitators and facilitate conversations around them. The first one I'm going to provide an overview of is the qualitative interview guide. So it's semi-structured and it can either be self-administered. So in that case, we encourage a group of people from various backgrounds, but also with different roles and functions within an organization to kind of work through the guide themselves. And it can also be used as a guide for a qualitative interview, right? Where you have your typical interviewer, interviewee kind of dynamic or group. And it could be one-on-one, or it could be, an interviewer with a few different folks. The probes are organized around common domains of major framework. For those who may be familiar, they're mainly organized around the CFR, so the Consolidated Framework for Implementation Research, or EPIS, and EPIS, so Exploration, Preparation, Implementation, Sustainment. And there is a strong focus on equity, especially towards the last items. It's 5 questions, I want to say. And it's really focused around who might you be leaving out of this implementation, right? Who might this be more challenging for? And as you'll see, the probes are also organized not just around common domains of major frameworks, but are also at multiple levels within an organization. The second guide that we have, or this one is actually a measure for contextual determinant, is the inventory of factors affecting successful implementation and sustainment, or IFASIS. And the IFASIS is also, again, multi-level measure of barriers and facilitators. And it was designed purposely to be able to characterize any context or innovation. It has acceptable psychometric properties and demonstrated practical utility. And it's been useful to really bridge the gap between researchers and community partners to be able to have conversations around implementation projects. And because it is a little bit more of a standardized instrument, we've been able to pool data across projects to answer kind of bigger implementation questions. So it's 27 items. It's completed as a team, right? So similar to the qualitative interview guide, we recommend that people come together and and discuss items one by one and reach consensus. Each item is rated both in terms of where an organization is at, right? For that item. So for example, is the financing available, right? And it's a 1 to 5 scale in terms of not available to available and fully funded. And then there's a second scale, which is an importance scale, and it's a 3-point scale rating the importance of that item to an implementation effort. And so this is a little snapshot of the tool itself, right? So you work one by line, and once you've rated the status of an item and its importance, then you get a little flag. Is it identified as a barrier, an opportunity, or an advantage? And then for each of these ratings, there's also a different shading, right? And the shading reflects the importance of the item. What we are able to do with the data collected using the IFASIS is we're also able to generate these dashboards or these visuals that we feed back to organizations, or that we use or projects have used to really center conversations around next steps, which areas to target as a priority, which may be targeted in a second wave of efforts. It's also been used to select, implementate, or guide the selection of implementation strategies. So here we have, both with the qualitative guide and the IFASIS, we have tools that can generate data to facilitate conversations on contextual determinants. It can serve as a document, right, to identify and reach consensus on priorities for an organization or a group, and help guide the selection of implementation strategies. And it is easy enough to administer both the IFASIS and, with a little bit more effort, the qualitative guide, to really also track changes over time as we're implementing a new intervention.
Great, thank you. So I'm going to talk about the STAR log, strategies, timeline, activities, and resources log, another of our tools. Next slide. Okay, so implementation strategies, this is a little implementation science jargon, but implementation strategies are the stuff we do to help people do the thing or the intervention. So these are the methods or techniques used to enhance the adoption, implementation, and sustainability of a clinical program or practice. So implementation strategies could be training, they could be audit and feedback, consultation, supervision, clinical supervision, and other kinds of supervision. It could be pulling together an implementation team to meet. It could be developing an implementation plan, implementation facilitation. All of these things are implementation strategies. Next slide. And so we have all these implementation strategies that often get used in in intervention studies or in QI studies, but we don't often track what it is we're doing, what implementation strategies we're providing to folks. So really important to track implementation strategies, and there aren't a lot of good methods to do this out there, or at least a lot of accessible, democratized, easy methods. But important to track implementation strategies for replication, so allowing other researchers to replicate the results of a study, understanding what happened to get the intervention used in study sites. So if you're implementing an evidence-based practice somewhere, you want to document like what kind of training was provided, how many people participated in it, and so really important to track that. Because the implementation strategies we plan at the beginning of the study aren't necessarily the ones that we actually provide throughout the study, or maybe we provide something different or new. It also can assist in translating interventions into practice. So what steps are needed to embed an effective intervention into a real world setting? Maybe a project provided, set out to provide 10 hours of training, but it really took 20 hours of training. And so we really want to know that if we're gonna understand what's needed to translate an intervention into practice. And then tracking implementation strategies is important to analyze the intervention effects. Maybe we had multiple sites or clinics, and some of them participated in some of the implementation strategies and some of them participated in others. And now we get to the end of the project and we have different outcomes across the clinics or sites. How can we understand and make sense of that? If we have tracked implementation strategies closely, then we'll might be able to use that data in understanding what happened at the different sites or with different samples. So we developed the strategies, timeline, activities, and resources, the STAR log, which provides this pretty simplified, centralized method for teams to track the implementation strategies. This can be used at any time in your project. It's really an Excel spreadsheet, but it is purposeful in that the items that are included, the things that we're asking people to track about each of the implementation strategies is based on one of the most used model in implementation science, the Proctor model of identifying and specifying implementation strategies. So we tried to make it, again, the really simplistic. It's an Excel spreadsheet. You can update it at any time that you want during the project. You can have a project coordinator update it every month, every 6 months, every year. You can even just do the whole thing at the end of the project. But again, it will provide that more systematic information for you to be able to understand at the end of the project what happened.
And so in talking about what happened at the end of the project, we can segue into implementation outcomes. And so the implementation outcomes, right, it's what we talk about when we talk about how much and how well was an intervention implemented, right? And so there's two typical frameworks that are used to capture implementation outcome. One is the RE-AIM framework, and the other is Proctor. And so this guide is organized around Proctor's framework for implementation outcome, which considers acceptability, appropriateness, adoption, fidelity, implementation cost, penetration, and sustainability. And so why is it important to consider implementation outcomes in QI project or effectiveness studies? Well, we really want to try to understand, right, an intervention's success or failure. We want to be able to address variability across contexts, right? So understand what happens in different sites or for different groups. It helps accelerate the research to practice translation. It can inform the tailoring of strategies down the line, and it can help us with long-term planning and the impact in real world settings, right, and sustainability. And so as kind of some concluding thoughts, right, we wanted to help synthesize how these guides and measures can help your improvement science projects, right? So they can help document to extent to which your project is using implementation research methods, right, and apply that as relevant to your project. It can provide guidance in helping engage with the right partners and what kind of conversations are can be important to have. It would help assess the context in which we're trying to change or improve practices, track the strategies used to create that change, and assess how much and how well the intervention was provided. And then just as a concluding note, these guides and measures are all available on our websites. It's cds.org, and you can follow the links to the implementations guide and measures drop down button on the menu bar, or you can scan this QR code. And then I think we can open it up to questions and comment right now. I'll stop sharing my screen so that we can see everybody, but happy to put it back on if we need to reference any slides.
Thank you so much, Heather. Thank you, Ellen. I would invite anybody to come where we can see you, turn your videos on, and let's give a round of applause. Happy for you to put questions in the comments as well. I'm loving the hand clapping emojis. And I have 2 questions for you guys already. One is really thinking as a quality improver, and one is really thinking as an implementation scientist. And from a quality improvement standpoint, like, how do you suggest people make a decision about which one of these, like, without spending a day orienting yourself? If you've got like an hour to orient yourself and make a decision, what would you suggest for folks who are frontline or managers who are thinking about using some of these tools and really feel like they've got the capacity to tackle integrating one of these tools into a quality improvement, like a just starting or a kind of just getting rolling quality improvement project? How do you suggest making that decision?
Yeah, I think that's a great question. And certainly we're not suggesting that all of these need to be, in every project. So I might sit for a minute, maybe if I had just a few minutes, I might sit for a minute with the DIRC SS, even just as an individual, and maybe walk through the questions and think about them and consider, like, which of these feel like it might be most appropriate for my project. Again, that's kind of an overview of all of the different pieces, and so you could consider that might help you to think about, like, oh, I realize that, like, we haven't engaged the right partners, or like, oh, I realize that implementation strategies might be something that would be important for us to track in this. Or I think that might be one way to think about it, and kind of to get started. I would also say that we're very willing to have conversations with folks. We're beginning conversations with folks about the guides and measures, and so would invite folks to reach out to us to ask questions. We're, again, as we started with, like, the whole purpose of CDI is to try to democratize implementation science, and so we are here to support the work that we've done by trying to get it out and get people using the guides and measures. So happy to answer questions, or even if it's a 10-minute conversation, we're happy to get folks started.
Yeah, that's fantastic. I think the strategies I hear from you, one is that and I'm blanking on the name, the CDISS, the first one that you guys—
DIRC SS.
The DIRC SS,
Yep.
That's like a good starting point. I also heard, like, going straight to whatever the assessment tools are and thinking just about how you are using them, and then reaching out to you guys directly, which is super exciting that y'all are available. And I would say I'm just going to keep rolling as a facilitator here, but I would encourage folks to put questions in the chat, and even about your specific projects, and what to include, from an implementation science standpoint. If you could ask all of us to use one tool and then provide that data back to you with some context, like, I could get really excited about Stanford really getting behind a specific tool, or maybe it's like one tool a year, and thinking about pooling our data to learn more about implementation science. And so I guess my question is, like, do you know of places that are doing that? Or, if you were like, if we could just get data around this tool this year, that would be great. Like, what kinds of things do you see happening in implementation science across organizations, if anything?
Yeah, I can get started on that, and Heather, feel free to jump in. But so CDS, which is one of the centers homed in Stanford CDI, has 3 research projects that are currently using the IFASIS as a tool to understand and evaluate context. And what we've been doing is we are starting our efforts to harmonize these data, right, with the idea to try and generate generalizable or more generalizable finding. There are a couple of other projects in the RASC, the innovation projects, that are also using the IFASIS and some of the other guides and measures. And I think one thing that, there's a question of kind of data pooling and data harmonization, but I think it's something we're really working on. So, we'd be happy to have projects contribute data to kind of further this work. And it's one of our big goals, right? Like, how do you make sense of data collected in different settings using the same instrument? So I'm not sure if that completely answers your question, but it is definitely something that's been on our mind and we're actively pursuing.
That's great. And it sounds like the, starting point is maybe to check in with you guys, either asking for a meeting or just shooting an email to y'all. Fantastic. Craig, I see your hand up. And other folks, feel free to raise your hand or put questions in the chat.
Thanks, Katie. Thank you for your talk, and especially a big thanks for making these resources available. In my pitches, primarily outside of the Stanford campus to funders, in describing a project or an intervention, I find that they oftentimes have very little awareness or familiarity with things like the Proctor model or any of the tools that you've just mentioned. But it seems to me that being able to assure a funder or a C-suite decision maker that you have thought through something in relation to improvement or implementation science would be very valuable. So my question to you is, have you found or have an example of a simple, maybe a one-slide, illustration of some of these tools, and that you can check the box and very quickly explain to a decision maker that you have thought through and are using some of these tools to strengthen your overall pitch?
That's a great question, and we can get that to you, Craig, for sure. I know that if people remember the old 3M, I think it was 3M pitch, like, we don't build things, we just make things better. Sometimes I feel like implementation science is that, right? We don't, we're not implementation sciences aren't necessarily creating the interventions, but they're trying to make them better, or they're trying to make them translatable. They're trying to get them used in practice so that we don't have that 17-year gap between the research and what actually happens with patients or clients. So I do think we're, and quality improvement, again, is you're doing the same thing, right? You're trying to bolster the amazing work that's already being done to make it better. So in terms of like a single, like one slide explanation, we can get that for you.
Yeah, I think it would be very helpful as a starting point, again, for audiences that don't have this level of knowledge or familiarity with implementation science or its tools.
That's a great question, Craig. And thank you guys so much for providing that slide. I see some folks on video. If you want to unmute and jump in, you're welcome to. And I know one of the big questions that we talked about ahead of time with this group was really thinking through how to use these tools in the day-to-day, how to make them as accessible and off-the-shelf usable as possible. So any questions in that vein, I think would be very welcome. Maybe while we're thinking of that, oh, Sam, if you want to go ahead. Yeah.
Yeah, well, jumping on that, you mentioned one of the tools had some case studies with the in the file. Would you be able to give us like a brief synopsis of like the major learning from one or both of those case studies?
So let me pull that up. I should say there's a couple places where we have case studies. I don't know if we mentioned it, but in the implementation outcomes guide, for each of the implementation outcomes, there are examples of how that implementation outcome has been measured in different kinds of studies. So those to me are like little mini case examples, like how do you use this implementation outcome, or how is it measured? So that's one example. And then I was thinking that the partner engagement guide has examples. Sorry, I just need to pull that up for just a second. Partner engagement guide, to my memory, has two case studies. And so one of the case studies is from a project called the Justice Community Opioid Innovation Network, or JCOIN. And the case study looks at how they engaged stakeholders to help accelerate and bridge the gap from new research findings to practice, create bi-directional communication between the target audiences and the researchers, and provide relevant information to key constituencies on new findings and innovation. So they're really trying to turn the research back to the community from which they, that helped them do the research, to understand like what are the outcomes and how is this relevant to ourselves and our lives. So it goes through a little bit about how the JCOIN project built practitioner and stakeholder boards, what the board members did, how they evaluated information about how that went. So asking the stakeholders for information about kind of how did this process go, you serving as a board member, and then disseminating that information back out so that folks would have a good understanding of it. So I think that that is a really strong example, at least in our field, of how practitioner and stakeholder boards are really important. And that's also an example of great interaction with the funder. So this project is funded by the National Institute on Drug Abuse, or NIDA, and they are keenly interested, like to the highest levels of NIDA, interested in these community and partner engagement boards. And so that if you're talking about like leverage or like an edge in terms of getting funding for a project, I can speak specifically to NIDA. They are very interested in making sure that folks are really connected to communities. And so this partner engagement guide is one way to work through that process, which might give your application for funding an edge.
Thank you so much, Heather. Thank you so much, Helen. Very exciting to have these tools and to have you guys as a resource. I'll invite you both to put your email addresses directly in the chat so that we have them before we wrap up. Anna, Sam, what is any other announcements, or what is our next lecture coming up? I might have it on my calendar.
Next lecture should be October 14th.
Great. And that is great. Yeah, that is Becky Blankenberg, likely talking about medical education. She's fantastic. So we're so glad to have you all today. Thank you so much. Please do claim the CME credit, and we will see you in a few weeks. Thank you again.